thank you, Director, for being here today. Senator Gardner.
Thank you, Madam Chair, and Director. Appreciate you being before the committee today and to answer questions. I really don't have a question, but just an acknowledgement. You touched on it, but probably not in enough of a meaningful way, as far as I'm concerned. The state's response on the Ebola crisis, even hearing from some who might have been skeptical at the beginning, even those on the other side of the aisle today would acknowledge that it was one of the most thorough responses, organized, thorough responses to a potential crisis. So I just want to thank you for being part of that team. I know you weren't the only member. You would readily acknowledge that something like that demands that you bring lots of people to the table. So for the administration, but as the point person, as the Director of Health, I just wanted to thank you for that. But I know that I think 2 days ago, I think I got another communication from you indicating other things that you're continuing to do to stay on top of that, because we know that it's not necessarily over, that there's more vigilance to continue to be involved with that on that important issue. So I just wanted to say thank you for that, and if that's an indication of pulling people together on key health issues, look forward to it.
Senator Flora.
Thank you very much, Madam Chair and Director Designated Hodges. We appreciate you being here today. I have a handful of questions. I'm basically referencing, and I don't know if the public has this, but we appreciate you providing us this overview of your assertion of your health-related experience. And so I'm basing my questions predominantly off of this document that you provided us. As I think we're all aware, at least those of us who are here on this panel, Ohio Revised Code Section 121.10b relates to the criteria for an individual to serve in the director's position for the Ohio Department of Health. It states that one needs significant experience in the public health profession, where neither significant nor public health is defined. So bringing us here today to this memo and to this discussion. So I want to start first. There seems to be 3 primary areas that you assert you had healthcare experience in between 1993 and 1999. The first is the Director of the Coordinated Care Program for the hospitals in William County. The second has to do with the community-based healthcare services at the Fulton County Health Center, and the third has to do with dealing with self-funded insurance plans. So I'll start with the first one. Can you give us a little bit more detail on what exactly your duties were as the Director of the Coordinated Care Program? And I note, and you note, that this overlaps with your time in the General Assembly. Maybe you can also tell us not only your explicit duties, but how often you were there and how you split your time specifically between your position in the General Assembly and your role as the Director of this program.
Chairwoman Jones, Senator Kafar, thank you. As Director of the Coordinated Care Program, we were fortunate. I represented the very northwestern corner of the state. We were blessed with a number of iconic names in manufacturing, large employers. And at the time, self-insured employers did not enjoy access to managed care or preferred provider organizations. They were basically simply paying a published rate for services on demand, fee for services. And what we did was we tried to extend the benefits of managed care to self-insured employers, not unlike we were trying to do with Medicaid and with the rebalancing the Medicaid program. And we didn't start with the posture that we needed to cut payments to providers. We started with it from the position that we needed to improve the quality of care, improve coordination of care, and by improving outcomes, we would also reduce costs. And it was a very successful program. We went from 12,000 covered lives to 35,000 covered lives in about 4 years. And what we did was we were able to coordinate the care in networks along the entire continuum of care so that people were not lost. Again, much like we're trying to do today with Medicaid. But we made, I think, important contributions and really went beyond where the industry was at that point in time by intervening in the critical pathways, by looking and saying, look, we've got the data on outcomes. We can see, based on the aggregate data, where there are flaws in clinical outcomes or in the critical pathway. And we could go into providers and say, look, we have a problem here with post-operative care, or we have a problem here with therapy, or with nurse-to-patient ratios, and it's affecting the outcomes of our patients. We were very successful. We moved the needle on improving outcomes for large populations, which is exactly what we're trying to do right now in state government. That program expanded to include environmental health issues, which are an important part of the Department of Health's mission, as well as looking at things like injury prevention, which is also another important part of the Department of Health's mission. Moving on to the second part of your question, as a legislator, that the legislatures are seasonal and cyclical. Many people have other jobs. It's a part of the citizen legislature tradition of Ohio. I was the same way. When the legislature was in session and active, I probably didn't work a 40-hour week. When the legislature was not active, I worked more than a 40-hour week. And the job complemented my responsibilities as a legislator, so that, as I like to say, I grew up in farm country around farmers, and a 40-hour work week is called a good start. And can be very active, but the jobs complemented each other, the schedule, not only the schedule, but my activities here in the legislature as well. I was on the Health and Retirement Committee when we were working to expand access to care, similar to what I was doing in my private sector job. We were working on CON at the time, which was a private sector issue. We were working on classifying opiates, which again is another important issue that is confronting the Department of Health today. And as chairman of the Commerce and Labor, we were responsible for workers' compensation during a time when we were introducing managed care organizations. So the jobs really complemented each other. I think it made me a stronger legislator and made me stronger in my private sector position because of that. And it was a great experience with community hospitals in this town.